I'm a mother of 7 children, and I have been working, well, first I got my Bachelor of Education, and I was working in the schools, but soon I changed my course of direction and studied Feldenkrais, the Feldenkrais method, and that's been the love of my life for 30 years now. When I'm working with people, I'm using touch. I'm using movement, but I'm accessing the nervous system. I'm accessing their brain. So I'm making changes in mostly children. Sometimes I work with women as well, but basically children and babies. I'm working pretty much directly on the brain. I love Hardy's Daily Essential Nutrients. I've been taking it. So I have myself and the 7 children. We've been taking it now for at least 4 years, or no, more than that. No, we've been probably taking it about 6 years. And I insist on the children taking it. It became a part of our life. I have to work reminding them, just like you remind them to brush their teeth. It's a bit of work, but it's worth it. We all feel really good on it, and my kids are they're not sick very often at all during the winters, and they're just alert and happy, and I feel it's made a big difference in our lives, because in the first years when we had kids, they weren't taking any extra nutrients, and then about the 6 years ago when we started, I think there's been a shift, a significant shift in health in my own personal family. In myself, there's no question I feel the difference. When I don't take the vitamins in the morning, I have less energy and I'm less alert, and I notice the change a lot. But I've noticed it in many people. A lot of my friends that are also in their 50s say that when they take the daily essential nutrients, again, they also feel full of energy and they get sick far less than they used to. All my friends, they call me and they're always telling me how good they feel on the vitamins. But I've also seen some pretty dramatic changes in the clients. So I've been working for 30 years, let's say, with children who have all kinds of issues. Sometimes they come to me because they have low self-esteem. Mostly they're awkward. There's something going on. They have social problems. Some of them are severely disabled. I teach all kinds of children. They come and we figure out what their needs are. Now, for many years, I taught kids without giving them the extra nutrients. And the work went well. But then we learned about the Hardy company, and when children started to come to me, I would encourage them to see Dr. Litman to have what we call the hardware-software program, again, working on improving brain function. So if they had nutrients, and then I would work with them, then their brain just worked better. They were able to learn faster, and the improvements were faster. So there are some pretty dramatic cases I wanted to give as an example, but it's interesting because I had about 22 years of working without this added part of the program, and then at least 6-7 years of encouraging people to go to Dr. Litman and explaining to them that we are working on the level of the brain, and the work in Feldenkrais is going to be the most effective, and your child will likely learn much faster if they have the extra strength of the nutrients. We had a whole series of teenage boys. Some had some breakdowns. They weren't even stable. Some were just Asperger's and weren't relating well to their peers or learning well in their high school setting. Some kids were just off, ADD, Asperger's, this type of child. I personally saw many. These children didn't necessarily come to me, but they were coming to our home office, and I was speaking to the mothers on the phone. I was very involved in getting feedback. And the mothers were just raving. They said that their child became normal, that they were able to learn, study in school, they were having basic normal relationships. And since then, some of them were able to marry as well, which was the goal. Some of them were very orthodox, but it was very important to them that their child grow up and become, have a family and go in that path, and they were very successful. We also saw a few cases of very severe cases where they wanted to institutionalize. One was a 14-year-old, one was a 17-year-old, and the system felt that they were just losing it and there was no other way. and we gave them the daily essential nutrients. I mean, that was the main part of their program. And it took maybe, one case I know it took about 6 months, and we made sure that they took the vitamins every day, and it was just like deflating this situation that was really out of control. And these kids calmed down, and they were not institutionalized, and they were fine. So you see that, and it's a miracle. You can't believe that it can be so successful. One case that I love to share, I share this all the time. I was actually working with their sibling. There was a boy he was probably the most severely disabled child that ever came to me. It was sad, he just was born that way. And eventually the mom had twin boys. Many years later, she could relate, and she had these beautiful twin boys. And then, for whatever reason, at age 3-4 months, one of the children regressed, had a serious regression. She said, she called us, she says, the boy is not holding his head, and he's lost eye contact with me. And the other boy's fine, he's just regular. So she got very frightened, and she came to see Dr. Litman, and he said, I want you immediately to start taking a lot, I don't know what dose it was, but it was a high dose of the daily essential nutrients, and breastfeed that little boy as much as you can. Breastfeed, 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 and you keep taking the nutrients yourself. And I don't think it was more than 2 weeks. He just came back. He just was 100% recovered. And I know the family, and I believe the boy is going into grade 1, first grade, this comes September, and he's fine. He and his brother are perfectly fine. And I should have videotaped it, because you literally saw that he wasn't connecting, and then 2 weeks later he was fine. He was rolling over, he was engaging. So I just thought that was remarkable, how she was able to pass the Hardy nutritionals in her breast milk, and it was that powerful. And another case is groups of 2-year-olds. We get a lot of 2-year-olds who again start this regression, and the parents come in and say, well, what can we do? I don't like this. Sometimes it's their speech, they lose speech. The ability, sometimes they lose all the speech, sometimes partial, sometimes they, again, they're not connected, whatever, there's the similar pattern of issues. But the remarkable thing is that, again, Dr. Litman would put them on the daily essential vitamins, the nutrients, and again, I speak to the parents, so these aren't particularly my clients, but the parents call me and they say, wow, the kid is fine. He went into his kindergarten at age 3 or 4, and the teacher doesn't notice any difference between this child and the rest of the children. So we've seen a lot of 2-year-olds who were recovered with the daily essential nutrients. You may have had them on more stuff, but it is the main part of the program. So almost 3 years ago, I get a call from a mom who has an autistic child. And the boy has been already autistic a few years, and somehow she heard about Dr. Litman and Mel Litman, and she wants to come and see if anything can be done. When she came, she right away said that the doctors said, there's nothing you can do, that this is the situation and we don't expect this boy to improve. And we said, okay, let's see. Now, they've been with us, and she's extremely dedicated. This is a mother who, when we said to her, the boy you need to get daily essential nutrients into him daily. And this is a mother who was not willing to accept the prognosis from the doctors, who said that this boy will not improve, that he was spinning, he was biting himself, he didn't have eye contact, he ran away. I mean, the first few sessions, we would look away for a moment and he'd be out the door, down the street, and we'd be looking all over the neighborhood for him. He couldn't sit still, he couldn't engage. A beautiful boy, and he was all over the place. But none of us gave up, we all believed in him. He started immediately taking the daily essential nutrients, and the mother said, she used to call me and crying and saying it's really, really difficult, because he wasn't eager to take it. But we told her that we suspect that it's going to make a very big difference. So she said, okay, even if it takes the full day, I will break it down, I will find a way. And I gave her suggestions, and she bought the powder because he couldn't swallow capsules. He was only 5 years old, 5.5. And it took her an hour, up to an hour and a half a day of hard work, and she got it in, and she got it in. And slowly, also the process became easier. The boy got used to it. It's part of his day, just like my children got used to it. And there started to be a big change. And it was actually phenomenal because he just started to improve. And in the last year, he was actually learning even faster. And the changes have been even more dramatic. So today he turned, like 2 weeks ago, he turned 8 years old. And you can have a conversation with him. He is calm, extremely calm, happy, plays practical jokes on his family at home. He sits at the computer. I could even speak to him in English. He learned how to speak 2 languages. He's very, very smart. Is he exactly at age 8? Not yet. Nobody would ever call him autistic because he doesn't have any of the criteria, although his speech is delayed. Let's say he talks like a 4 or 5-year-old, not like an 8-year-old. So you see that there are, although sometimes he actually speaks at his age level as well. But in overall, he's a healthy boy. He's a happy kid. He's learned in my program, I mean, I work with him in the water. He's learned to swim. He jumps on the trampoline. We work on the table. But I have to say, even the longer the process goes, it can go even faster. His brain is getting sharper, and I mean, he takes other things as well. But all these years, that has been his base. The daily essential nutrients has been his base, and we've added, and over the years, and it's just so much easier to teach him. He learns better than a lot of my quote regular kids who weren't diagnosed with anything in particular. They just have fine motor or gross motor problems. So he's a pleasure to teach. He's a joy to teach, and loves to come. He runs in the door, calling my name and looking for me and hugging and kissing. Not typical. I mean, years ago he didn't do that. And the changes, there's so many changes, like the affection and the ability to say I love you. And I must say one more thing, because I am a teacher and I am involved in schools. I'm involved in all my children's schools. Unfortunately, there's a lot of children taking medication in school. And the interesting thing is, not only does he not take extra medication, he's fine without it, but in the school itself, the social workers and whoever they consult with said, this boy, he never needs medication. He's the calmest kid in the school. He is so calm. I mean, you sit him down and you tell him about the work and he does the work, he cooperates. He is one of the most, he has an aide. He doesn't sit by himself. He does have an aide, and he isn't exactly like everyone, but the aide has an easy time with him because he cooperates and he's happy and he does the work, and people don't have an issue. So personally, if I'm going to summarize, I have seen many, these is just my top stories that come to mind that I'm sharing with everyone, but I believe that everyone should be taking this from pregnancy and forward. I have seen in all age groups and all levels of life changes from my own personal family and life to the clients I work with, to the patients that Dr. Litman sees. And I'm just very happy to be able to share all this with you today. I really think that the daily essential nutrients are such a good product that I think pretty much everyone should be on it. If you ask me personally, I encourage pregnant women to take it. I think right from pregnancy to breastfeeding to children, through the ages, through the entire lifespan. I can't encourage people enough. I mean, I've seen so many results with it in my own family, in my extended family, which I didn't even speak about, in these cases that I brought that are very powerful, but there's many more cases too. I just brought some of my favorites to share. I just think that everyone should be taking the hearty nutritionals. People that want to live their life, it gives you that much of an edge to stay healthier, to stay further away from any illnesses today. and gives you lots of energy. I believe that it gives extra energy. I believe it makes people more balanced throughout the day. Emotionally, it makes them more balanced. Physically, they have more energy, and you feel good because you know that your body is balanced and you're in much better health. And so I just think that it's a good idea for people to consider adding it as part of their lifestyle.